Good morning, everyone. So, as sir already mentioned, this session will be taken from both anatomy department and pathology department. Okay. So, the outcome or the learning outcome of this session is describe the gross anatomy of the breast. Okay, and the second question is explain the applied anatomy of the breast, and the third question will be understand the diagnostic approach of CA of breast. Okay, so we will start with the gross anatomy of the breast. What you all have learnt in the gross anatomy of the breast? First, we have to start from the location part, where the location of breast can be or your mammary gland can be seen. And the second part is extent, right? Then followed by the gross structure of the mammary gland. So tell me about the location.
So basically it is located in the superficial fascia of the pectoralis major muscle.
Okay. So basically we see the mammary gland in the superficial fascia of the pectoral region, right? What about the extent? Do you know about the extent of mammary gland? From which region to the which region it is extended vertically and also horizontally? Something like this diagram will come, no? This is called vertical extension and this is called horizontal extension. So from where to where we can see these extensions? From the first rib to fourth rib. Fourth rib or below the fourth rib, okay? Lower or posterior border of the fourth rib. And what about the horizontal extension? From the lateral border of the sternum to the mid-axillary line. Hope everyone is aware what exactly is mid-axillary line. What is the basic definition for mid-axillary line? Mid-axillary line. At least can you show me where we can see the mid-axillary line? In this particular region. Okay, this is called mid-axillary line. What about the gross structure? Is this diagram will be enough to study the gross structure? Is this diagram okay? Which diagram you have studied for gross structure? This diagram or like this diagram? This diagram. So tell me the parts. How do we divide it? Do we divide it like superficial part, mid part, deep part? How we all have studied the gross structure? So in this part we can see the presence of your nipple and areola, right? Nipple and areola part. Nipple followed by areola part. This is the superficial most structures. Okay. What about next structures? Lactiferous. Right after this. Shall I draw like this? Is it right? Okay. So this will be your lactiferous duct. Okay. Lactiferous duct. What is the significance or function of lactiferous duct? What is the significance or function of lactiferous duct? Please use the mic. Pass the mic to others, second bench, third bench. Others? How many lactiferous ducts can we see? Any number? How much? 15 to? Okay. 15 to 20 lactiferous ducts can be seen. So what is the function of these lactiferous ducts then? Secretion of? Okay. Secretion or production of milk. Anything else? Transport. Okay. It will just transport the milk. Okay. Fine. What about the next structure after the lactiferous duct? Nodes. Lobes. Okay, lobes of? Can I draw it like this? Is it okay? Okay, then what is this structure? Lobes of mammary gland. For newcomers, where are the newcomers? Can you please raise your hands? Okay, so you guys were also not there during the mammary gland part. Okay, you can just take down the notes, try to remember the important names, okay? Right now, just try to remember the important names, more than enough. So, what is the function of lobes of your mammary gland? It helps in the, okay, it helps in the production of milk. Anything else? Anything else? Fine. What are the other structures you see in the mammary gland? Is there any other structure after the lobes? Yes? Suspensory ligaments. Okay, fine. I'll just draw the suspensory ligaments like this. Okay, these are called suspensory ligaments of Cooper. So, what is the function of suspensory ligaments? What are the functions of suspensory ligaments? It will hold the structure. Fine. Anything else? So, what is the function of suspensory ligaments? One thing your friend said, it will help in the holding of the mammary gland part. Anything else? It will separate the, okay, it will separate the lobes. Fine. It also helps in the stiffness of your mammary gland. Okay. So the small, very small movement of your mammary gland is controlled by these suspensory ligaments. Okay. Any other structure you have studied in the gross part? Mammary space. Okay. Mammary space. Fine. What do you mean by mammary space? Mammary spaces. What is the significance of mammary spaces? It is the gap between the pectoralis major muscle and the lobes of the mammary gland. Okay. Why is that gap important? Is there any significance? Can you please use the mic? Okay, it will help the movement of your mammary gland over the pectoralis major muscle. Fine. Any other answers? Any other structures you remember in the mammary gland? Any other structures you remember from the gross part? Fat part, okay. Mammary fat. What is the significance of fat? Please be little louder. It provides structure to the mammary gland. Okay. Any other points in the gross part? Okay, your fat part will also fill the gaps between the lobes present in the mammary gland or breast. Fine. Any other points you like to discuss in the gross anatomy? gross structure of mammary gland. That's it. Okay. What about the blood supply? What about the blood supply of mammary gland? What is the reason behind pigmented area of the areola? Your areola region is pigmented, right? Yes or no? This region is pigmented. What is the reason behind it? Okay, because it secretes oily substance, secretes oil and protect the nipple area. Okay, any other answers? Any other answers? Protect nipple area. Protection of production of melanin. Okay, production of melanin. Did they discuss about this? Discussion is finished about the areola and nipple region. Yes. Okay. Fine. So the pigmented area is because of the production of melanin, and also it will help in the secretion of oil, which protects the nipple area. Fine. What about the blood supply? Blood supply of mammary gland. How many important arteries are there here in the mammary gland? 3 arteries. Okay. First one, axillary artery. Axillary artery followed by coracobrachialis, thoracoacromial. Thoracoacromial. Next, intercostal arteries. Intercostal arteries. Any other arteries? Internal? Okay, internal thoracic artery. Internal thoracic artery followed by super. Say it again. Superior thoracic artery. Okay, superior thoracic artery, and one more artery. Subscapularis artery. Okay, fine. Okay, so your friends have mentioned about total 6 arteries. Among 6 arteries, the first 3 are important arteries that supply your mammary gland. So now tell me which region of the mammary gland these arteries supplies. Which diagram you have studied for blood supply? This diagram. Shall I clean this? This diagram for the blood supply? Okay, fine. Tell me. Which artery will supply which regions or which part of the mammary gland? This part? Okay. This is the lateral branches of posterior intercostal artery. Next, this side. Okay. This is internal thoracic artery. Next, here, this side, towards this side. Okay. Acromiothoracic artery and lateral artery. Lateral artery of which? Lateral thoracic artery. Okay. Where? Superior. Here? Superior thoracic artery. Any other arteries? What about the axillary artery? The very first one? Axillary artery. From the sides. This is axillary artery and these are the branches of your axillary artery only. Okay, fine. Sit. Anything else in the blood supply? That's it? Okay. Yes? What about the nerve supply of mammary gland? What are the nerves that supply to your mammary gland? What nerves supply to your mammary gland? Say it louder. Anterior and lateral branches of anterior and lateral branches of 4th to 6th intercostal nerve. Those are the nerves that supply to your mammary gland. Okay? Any doubts? Out. Next, the important topic is lymphatic drainage of your mammary gland. Even you got that question in your test, right? Okay, stop talking. Next topic is lymphatic drainage. So what are all the points you remember in lymphatic drainage? Lymphatic drainage should always be studied under two headings. The first one is lymphatic nodes and the second one is lymphatic vessels. Okay, these are the important topics you should study under the lymphatic drainage. The first thing is lymphatic nodes, where your lymph is present. Through that lymph will be carried to the other structure by your lymph vessels. Okay, what are the important lymphatic nodes we study in mammary gland? We have three sets of lymph nodes. The first one is axillary lymph node. The second one is internal mammary, which is also called as parasternal, right? Parasternal lymph node. Then followed by some other groups of lymph nodes. What about the lymph vessels? The lymph vessels of your mammary gland. We have superficial lymph vessels and deep lymph vessels. Okay, remember, this is the very basic thing you should remember in the lymphatic drainage of any structure. Okay, so what is the diagram for lymphatic drainage? So this is the diagram you should draw for your lymphatic drainage part. Okay. So we have, this is the mammary gland region, this is the midline. Okay. How do we divide the mammary gland to study the lymph? We divide it into 4 quadrants. What are those? Superior. This is called upper medial quadrant, followed by lower medial quadrant. Then on the other side we have upper lateral quadrant, then lower lateral quadrant. These are the important quadrants you should remember in the mammary gland. Okay. Next, the very first one is axillary lymph node. Where we can see the axillary lymph node? Or where you are going to mark your axillary lymph nodes? First we have anterior group of axillary lymph node, followed by posterior group of axillary lymph node. Posterior I am marking next to the borderline. Okay, so you should remember it is present in the posterior aspect. Then we have lateral group of axillary lymph node. Then we have which group here? Central group, followed by apical group. Okay, that is the axillary lymph nodes part. Then we have parasternal lymph node. Where we will mark the parasternal lymph node? It is marked in the here, right? This is your parasternal lymph nodes. Okay. What about the other lymph nodes? Can you name any other lymph nodes in your other group of lymph nodes in the mammary gland region? The very first one is supraclavicular lymph node, which is present above your clavicle bone. Okay. And the another one is posterior intercostal lymph node, which is present here in this region. Okay. What about the lymph plexus? What about the lymph plexus? Lymphatic drainage is discussed or not? Yes or no? Say yes or no. Yes, it is discussed. Okay. Then what is this plexus? This is your subperitoneal lymph plexus. Okay. These are the important lymph nodes you should remember. Now we will talk about or discuss about the lymph vessels. So what about the superficial lymph vessels? Which part it will drain? Your superficial lymph vessel will drain skin region of the mammary gland, except nipple and areola part. Okay. What about the deep lymph vessels? Parenchyma part. So you know the name parenchyma, stroma, everything. Do you know the part parenchyma? Do you know the part stroma of the mammary gland? Those are the points you should mention in your gross structure part also. You should mention that in your gross structure part also, okay, which is very important. So it will drain from the parenchyma part, areola. Okay. Now tell me the lymphatic drainage flow chart. I'll share the notes, stop clicking the pictures. Tell me the flow chart. First, the lymph will drain into anterior group, posterior group and lateral group, right? From the anterior, posterior and lateral group, it will drain into the central group. From the central group, it will drain into apical group. From the apical group, it will drain into from here it will drain into supraclavicular. It will drain into supraclavicular. From supraclavicular, it will drain into the lymph will drain into subclavian lymphatic trunk. From the trunk, it will drain into your brachiocephalic vein. Respectively from the right side and also from the left side. The left side lymph node will drain into your left brachiocephalic vein, and from the right side it will drain into right brachiocephalic vein. This is how the flow chart of your lymph node will go. Okay. Can any one of you mark here in this diagram? Concentrate. You just see the diagram and try to this. You just have to put the arrow marks. Go. Yeah, just this arrow marks. All three of you discuss together and write it down. Go help your friend. Others, please open your textbook or see this diagram. Okay, this is the diagram which I have tried to explain and draw on the board. Okay, next this diagram. This shows the flow chart of your lymphatic. This shows the flow chart or flow of the lymphatic drainage in your mammary gland region, including your abdomen region also. Okay, so try to remember this diagram, revise it. So we can see here from the anterior and posterior lymph group, this lateral lymph group will receive the lymph from your arm and forearm region also. Okay, so now the anterior, posterior and lateral group of lymph nodes will drain into your central lymph node part. From the central, it is going into your apical part. From the apical, it is going into your supraclavicular lymph node parts. Okay, this is the same thing I have explained here. After supraclavicle, it will go to the subclavian lymphatic trunk, followed by your brachiocephalic vein part. Okay, any doubts? Any doubts in this diagram? No doubts? Okay. If you see in this diagram, I have mentioned about the subperitoneal lymph plexus, right? So from the subperitoneal lymph plexus, it is reaching until your ovary part. So this is like from the mammary region to your abdominal region, from the abdominal region to your pelvic region. Okay, this is how the flow chart goes. Any doubts? No doubts? What about the clinical importance? What are all the conditions we have discussed in the previous sessions? Breast cancer. Remember this diagram? Yes. What is this? Swelling. Okay, fine. Others? This diagram is particularly to show the radial incision of your mammary gland. Can you see this red line? This is how the radial incision will be done. What about this? Folding of the skin. Why it happens? Okay. Which structure is affected here? When your cancerous cell affects the suspensory ligament, it will lead to this kind of foldings. Okay. What about the next condition? This is called pudy orange appearance. Remember? Yes. How does it happen? When the superficial lymph vessels got affected by the cancerous cell. We can see the skin of the mammary gland turns into an orange color condition. Okay. This diagram shows the self-examination of your breast cancer. Okay. Last time I have added different picture. This time I have added from your textbook only. What about this one? Mammogram of the breast. This one? Biopsy. Up. So the next section will be continued by madam. Okay. Thank you.